Time for Ask the Expert. Tonsillectomies have been in the news recently after a 9-year-old unexpectedly died after the procedure.
We have Dr. Brian Baer here to discuss this important topic. And a lot of people are saying, what is a tonsillectomy? And did I have that when I had my tonsils removed?
Exactly. A lot of people don't realize that you have lymphatic tissue in the back of your throat that helps fight infection. And what's interesting about it is back in the day, before we had really good antibiotics like we do now, almost everybody had their tonsils out. I had my tonsils and my adenoids out when I was 2. Most people did. But now we treat with antibiotics and avoid a lot of that surgery. The usual reason to remove the tonsils now is if they're so big, they're like golf balls and they obstruct breathing, or they fail to respond to antibiotic treatment.
And some people have them removed later on in life. Is there a risk for having it done as an adult?
Well, absolutely. What's interesting is that bed that the tonsils lie in is very vascular. It's got 3 arteries coming into it, and as you get into adulthood, it becomes larger. So there's a lot higher risk of bleeding, and there's a lot more cautery that goes on to stop bleeding during the procedure, and so there can be a lot more suturing, and therefore it's a lot more painful. So we always hear about people who are having the surgery when they're older and they stay home and they drink malts all day long just to try and soothe it.
Well, and I remember really having this as a child. I'll probably date myself here, but I think I was in the hospital overnight, you know, for it. And so there was like a 24-hour period, if not longer. So why, you know, then they did it because there's always concern about complications?
Well, absolutely. I think the big thing that they're concerned about is bleeding, and sometimes they'll keep people overnight if they had trouble getting the bleeding to stop during the procedure. Typically, if there's dire consequences from bleeding, it's much further out. Once you're home, you're a week out, and all of a sudden the scab or whatever is on the bed where the tonsils were removed starts to bleed significantly. And then the other risk, of course, is infection, and that has a greater risk than bleeding by a long shot.
So what are you going to look for in what we could learn from what happened to this 9-year-old boy?
Well, based on what we talked about, I think that the risk of the 9-year-old dying from bleeding or infection would be unusual because that would be over time. But there's something else going on, and I think that we need to wait and see what shows up in the post to determine really what happened.
All right. Well, thank you, Dr. Baer. We appreciate you coming in. If you have a question for our experts, you can email them at asktheexpert@todaystmj4.com. You can also leave a voicemail at 967-5253. We'll be right back.